Cardiovascular drugs, Digitalis Glycosides. It is essential to understand the actions of various drugs affecting the heart, their sites and mode of actions, and their clinical uses. Digitalis glycosides, also known as cardiac glycosides, are important drugs used for the treatment of congestive heart failure. They have the ability to increase the force of myocardial contraction and to increase cardiac output in failing heart, or the positive inotropism. All digitalis glycosides are derived from plants of similar species, which are collectively called foxgloves by the shape of their flowers. These plant sources includes Digitalis purpurea, Digitalis lanata, Strophanthus combe, and Strophanthus gratis. The active glycosides of Digitalis purpurea includes Digoxin, G-toxin, and G-talin. For Digitalis lanata, it includes Digoxin, Digoxin, and G-toxin. For Strophanthus combe, its active glycoside is strophanthine, and for Strophanthus gratis, its active glycoside is wobane. Cardiovascular action of Digitalis glycosides. The cardiovascular response to Digitalis glycosides result from a complex of direct and indirect action of the heart. The direct action of Digitalis glycosides produces a positive inotropic effect, which includes the increased force of myocardial contraction, the increased rate of development of myocardial tension, and decreased time of peak tension followed by faster relaxation. This positive inotropic effect of Digitalis doesn't seem to depend upon adrenergic stimulation. It is believed to be a consequence of inhibition of the sodium pump. The indirect action of Digitalis glycosides is made through the parasympathetic autonomic nervous system, which affect the electrical activity of the Purkinje, atrial, and ventricular fibers, which in turn influence the excitability and automaticity of the cardiac tissues.